This fascinating aspect now of the COVID-19 situation. 4 COVID-19 patients under quarantine in Addington Hospital in KwaZulu-Natal want to be allowed to self-quarantine. They've been isolated for 10 days. They were among the 10 people who returned from Italy at the beginning of the month. The group's legal representative, Mark Fucha, joins me now on the line to talk to me about what it is that they're demanding. Mark, good afternoon. Thank you for joining me. What exactly are you demanding for your clients, and is this headed to court?
Good afternoon. Thanks very much for having me on the show. What is being requested, in essence, by my clients is that they be treated the same as approximately 150 or more other patients have been, in that they are allowed to remain at home, self-quarantined, until such time as they test negative for the virus on 2 consecutive occasions. Now, these persons were self-quarantined before they were admitted to hospital. So all we're asking is that that situation be allowed to resume. None of them presently have any symptoms any longer. They're entirely healthy. And it seems just to be a drastic waste of state resources to have healthy people taking up space in a hospital where there are undoubtedly more deserving individuals who need that treatment and need that space. Now, our correspondence to the NEC, amongst others, has remained unanswered. And the point of concern is the inconsistency with which my clients have been treated. They certainly have been treated well by the hospital, and the level of care has been very good. So there is no complaint there. But as you could understand, individuals want to be able to be at home in terms of making their recovery, and they have a constitutional right to self-quarantine and to remain in their home environment while they wait to be tested negative, which will inevitably take place fairly soon, I would imagine.
Sure. And I do want to return because, embedded within what you just said is a bit of good news in as far as the health of your clients is concerned. I will return to that in a moment, but I want to ask you about the inconsistency that you are talking about. You are saying other people who had tested positive before have been allowed, after a period of time as their health improves, to go home and continue to self-quarantine at home. And that is the essence of what your clients are aggrieved about.
Well, that's correct. In fact, not that they've been allowed to go home. They've never been hospitalized at all. And I noticed earlier on your program, you led a story dealing with Mr. Myers and his wife, who had returned and who had tested positive from Knysna. And they have not been hospitalized. They are at home recovering, and they are symptomatic. You must remember, my clients are asymptomatic at this point. So there is a blatant single example of the inconsistency that's been applied.
What about
that is widespread. As I say, it relates to a far greater number who simply have not been hospitalized.
Mark, what about the latest regulations that have been issued in response to the situation with COVID-19, right? In as far as the whole limitation of your clients' rights and how it relates to the limitations clause in our Constitution, the whole situation around the regulations being a law of general application and therefore fitting that criteria. And also we saw in those regulations that no one may refuse treatment and being quarantined.
Certainly, and what we must understand, though, is that we are not in a state of emergency. I'm no constitutional expert, although I have consulted one. My clients still have constitutional rights, and those rights are being infringed because, as far as the regulations are concerned, those regulations are there to protect the majority of South Africans who may become infected by an infected person who is demonstrating or displaying symptoms. But we're not asking that my clients be released into the general public. We've been very clear on the fact that they would be allowed to go home to self-quarantine and would continue not to have any contact with any persons until such time as they have successfully tested negative on at least 2 occasions. So that, I think, is a misunderstanding. And that is the way in which, as I say, over 150 other patients who have tested positive have been treated. They've been allowed, both before and after the regulations, and I refer again to Mr. Myers and his wife, to self-quarantine and to fight the virus in their homes, as it were, rather than being in an institution. And again, it's a complete waste of state resources to have 4 healthy people taking up space in a hospital where there are ill people who require that treatment. And those sentiments, I think, are shared by those present in the hospital who have been treating my clients, who say, you're well. There are people sitting in a line downstairs who desperately need treatment. And that's really where the unfairness or the injustice of this matter arises. It's alarming also that the NEC's office, in fact, no one, not from the hospital or the NEC's office or anyone, has in fact even responded to our correspondence.
Yeah, and Mark, just on that point, clarify for me then, you've not had any joy with the Department of Health in the province, no response, you say, from the MEC's office. What then? Are you going to court?
Well, we wouldn't want to have to go to court, unfortunately. I've sent through the correspondence this afternoon, once again, offering to abide whatever conditions the state would wish to impose on the self-quarantine arrangement. And I've asked for a reply by 4 o'clock this afternoon. As I speak to you now, there has been no reply to that. To the extent that we get to Monday and there's been no further action taken, we may well be forced to take this matter to court on an urgent basis.
All right. Mark, thank you so much. And I think nothing more needs to be said, really, about the condition of your clients, the 4 of the first 10 that had been diagnosed. Mark Fuchada is their lawyer, telling us